Thrilled to be here. Thanks for cutting your lunch short. I'm going to talk a bit about what design thinking is and why it's valuable, why you might like to think about using it, and tell a few stories, and then give you some insights on what we're seeing and what you might want to be thinking about. But interestingly and thrillingly, a lot of you are already thinking about these things. And then I'm going to end with some personal observations of how designers think. And so one of my goals is for you to leave with a few ideas on how to tweak the way you work your daily life to think like a designer. IDEO is we're a bunch of our friends. We met at Stanford in the late 70s. We started the company right off campus, a half a mile off campus. That's me in the upper right in 1980 with the big hair and the big glasses. Now we're 675 people. We're in 10 offices around the US and Europe and Asia. At first we started with mechanical engineers, that's what I am, and industrial design, that's what I am, and computers and high-tech products and medical products, just things. That's what design was good for. Over the last 40 years, it's evolved, and now I think we have 18 or 20 different disciplines, including physicians on staff and everything from environmental designers to food scientists and then we work on almost every category of business. In fact, it's easier to say that we just don't design tobacco products and firearms now. The heart of this practice is this design thinking used with multidisciplinary teams. It's all this kind of an innovation process that's human-centered, and I'm thrilled and just pleased to hear this phrase used over and over here at this conference. It's kind of a balancing act between people factors, business factors, and technical factors. And all are equally important, except that the people factors are slightly more equally important, we like to say. Starting with what's desirable, and then having what's viable and feasible follow. That's what seems to work. And starting with research and observations kind of in concrete and going through an abstract phase and then coming back into products, services, and experiences. But I like this kind of a compendium slightly better. There's 3 buckets to this process. There's an inspiration phase, an ideation phase, and an implementation phase. And they're roughly equal, and this could all happen in a day, or in a few weeks, or in a few months, or in the case of medical products, a lot of which I focus on, sometimes years. I'm going to just talk about a few of these today because that's all the time I have, but a little bit about observations and empathy, and a little bit at the end about telling stories and prototyping. But everything starts with empathy. As engineers and designers, we early in the 70s and 80s, we didn't get much of this. It was like, that doesn't seem very important. Let's get to solving the problem. But unless you know what the problem is, it's not worth solving. So this design of designers, we've got anthropologists and psychologists and people with both in design backgrounds. And if you're not one of these, you might consider becoming one, or hiring them, because it's a very important part of the process. And the key is trying to get at what people are thinking and feeling, and you get at this by what they're saying, but especially what they're doing, because that sometimes is a contradiction. You're trying to understand what people's needs and motivations are on many different levels: cognitive, emotional, physical, through social and cultural lenses. And that means immersing yourself wherever the problems might be. And I've seen this reinforced over and over, but this doesn't mean focus groups. They come on later in the process, but early on you have to walk a mile in people's shoes. And you have to get inside what's going on. Now, I said in the early days, in the 80s, we did a lot of products, and we still do a lot, but that's expanded. But I was there in 1980 when someone came in the room and he yelled at us that he wanted a $10 mouse. And so we all kind of know who that was. We said we could do it. We didn't even know what a mouse was, but we got to design the first mouse, the first laptop, the first handhelds, the first cameras, the first defibrillators. It's very valuable at the front end of these industries. And I know there's 400 industries like that here, so it's lovely to see this kind of energy level here. But over the years, we've moved up this ladder of abstraction from tangible things that break when you drop them all the way up to brands and services and strategies and environments. And this process of design thinking seems to be valuable at every level. So Walgreens, what's the experience of people in a Walgreens pharmacy, or the experience of people in a Converse branded store, or the North Face in China? What's a customer's experience there? On the lower right is we work for the healthcare system in the Southwest, St. Joseph healthcare system. In addition to care, what's their sacred mission? How do you experience that? So how does a patient experience that? So design thinking again, working for the TSA, training the 55,000 TSO agents. What's the experience supposed to be there? Not always great, but a lot better than it used to be, I would posit. And that's supposed to be all I can say about that, I think. Designing a school system from the ground up in Peru, and that includes the physical space, the curriculum, the technology, the student interaction, and so now there's 20 or 25 schools based on this principle in Peru. A whole new, carefully thought out device for voting for the County of Los Angeles is just being pilot tested now. And they're going to make 15 or 20,000 of them. They easily pack up in a package. But the biggest thing is they accommodate 85 languages. They accommodate people who cannot see, who cannot hear, who have other disabilities. A wheelchair can roll up with this. And so there's many different ways to interact with this. Looks like it's on its way to being something that other people will adopt, not just LA. What's the whole experience of riding in business class in Lufthansa? So you can see a big prototype here and lots of small tests, but how to do that. Again, prototyping and testing is a valuable part of this process. What's work for hunter-gatherer in China? A lot of challenges for food and food safety and quality in China. So this was a whole ground-up startup, from growing the produce, the products, to shipping it, to serving it or selling it in stores. A lot of these problems, a lot of these projects, we like to try to start with open-ended questions. How might we, or what if, or what is the future of? And so that you don't have, the problem statement doesn't contain the answer. Pillpack is something we helped start up out of one of our East Coast offices. How might we make the effort to stay on multiple medications easier over time? A big challenge, a majority of Americans are on more than one prescription, and there's a lot of solutions out there that don't work very well to help people stay on multiple prescriptions. And so teaming with pharmacists and other entrepreneurs to start looking carefully at the problem, immersing yourself, and then making prototypes and testing, paper prototypes, online prototypes, trying to understand if there's different ways to present medication to people that would be better. Mall intercepts to test for look and feel and price, and online testing, A versus B versus C. And what came out of the whole design process was this lovely medication, all your medication in a box, in a tape, so that the next envelope that comes up has the date and time and whatever you're supposed to take in it. And the increase in adherence has been remarkably successful, increasing adherence 80 or 90%. They're in startup mode. other story was work for NYU. How might we improve the patient admission experience? And so this was a case where great care at NYU over time, great outcomes, but bad patient feedback because of a lot of different details about the experience of getting in and getting out of their facility. So our team got permission to admit themselves for unknown reasons and go through a battery of tests. And so they recorded every single bit of experience that happened to them. And they also interviewed many other patients coming and going. And what came out of that was they had a great deal of observations that they said, we've got to feed this back to the middle management in a way that maybe we can get some better understanding. So they said, we're going to have a mid-course presentation. We're going to have it at this well-known restaurant. And so everyone shows up there. And so half the people are put into the kitchen, and some people are sent. Everyone has to go and put on different shoes, and they all are weighed in. They're all read foodborne illness lists. They all get to sign papers at different points. Some have to get weighed in part of the way through their meal. Some people are sitting by themselves. Some people are sitting with a large group. Some people are sitting off in their own place. And so orders get taken. Sometimes orders come immediately. Sometimes they don't come. Sometimes you get another order. So by the end of this, everyone was quite frustrated and said, what's going on here? And then they read down, here's exactly what your patients are experiencing on their way in, on their way out. And so everybody kind of, oh, I get it. It's not just about exactly outcomes, it's about how it's hospitality again. It's the experience of coming and going out. And so that everybody got on board, and that was some of the most productive few weeks of brainstorming and testing. Over the next 6 to 9 months, their scores went from very low to very high in some of this patient satisfaction. So again, a very good example of this sort of a thing working. So we see a lot of companies from small to medium to large, and I've got some observations that it seems to be big opportunities, but luckily I see a lot of people here thinking along these lines, but I'll just go through it. How might we use design to help us gather, manage, and utilize our ever-increasing data for health, for better health? We're experiencing this tsunami of data. It's, by many measurements, we've produced more data in the last 2 or 3 years than we have in all the rest of recorded human history. And a lot of that is in healthcare. And not telling you anything you don't know, of course, I love seeing that we're inventing new words every few years to see how big the amount of data is. Now we're to zettabytes. Or what comes after Z? I guess we have to go back to A or something. There's a new kind of device coming out almost every few hours, I know, because we're working on them. And so there's design there, but what do you do with all this data? And luckily, people are thinking and working this way, but it's like the woman from from Armstrong, what was her name? Tamara, no, that was, I had this down here. Jess, she rightfully pointed out how valuable this data is for individuals. But right now there's so many platforms. The real opportunities are aggregating this and feeding it back to us in ways that we can act on from many different data streams. Somebody downstairs is working on this, which is cool. And healthcare professional engagement with the patient. Now there's a fair number of physicians here and people that represent them or work with them. Our physicians are being overwhelmed. They're getting burned out. They're frustrated. They're spending, by some measurements, half their time away from patients. We've created the most talented, highest paid data entry clerks in history. And so how do we use design to help give physicians and healthcare professionals some of that time back to spend with patients? Telemedicine, telehealth, the woman from Tamara from Xerox had some interesting points here. This is coming on strong. People are working on this. Hundreds of different organizations are working on this hard and more every day. So how do you make this a great experience? And genomics, the cost of the genome has gone from 100 million to like $900 in 15 years. So it's stripped Moore's law like crazy. So what is it? But we have all this data. How we need to understand it, synthesize it, and feed it back to people to allow them to act on it. And then helping people manage or avoid chronic conditions. Of course, this is building on Sean's thing, Homada. We're our own worst enemies. We're responsible, at least in half, by most measurements, for all this increase in chronic conditions. But how do you actually help people? How do you? It's more than just technology. It's more than this quantified self. What Sean pointed out is the social aspect. We call it quantified us. There's something valuable about being in a social group and beyond, and utilizing this data and supporting each other. And so that's a neat thing that's happening, and there needs to be more of that. And then the last thing is the social determinants, or the built structure, the infrastructure, the built environment. I'm pleased to see lots of positive things going on in Nashville, but throughout the country, we don't live where we work and where we shop and where we go to school. There has to be a lot of improvement here. I love the work from Jeff and Chris yesterday with J&J and Wakefern Foods. So that's a step in the right direction. There needs to be lots of partnerships. And so you need to go from quantified self to quantified us to quantified communities in some way. So I love the work of this Dan Buettner, who studied the blue zones around the world where people regularly live to be healthy at 100 and more. And he's applying this to 30 different communities around the country. But that's just a drop in the bucket. So there needs to be more of this. So my last bit is how to think and act like a designer. There's this thing we call the workaround. So you should try to cultivate an awareness of things that are going on around you, the little things, and just look at them as, that's odd, that's interesting. Take pictures, take videos. Like, no doorstop here or here, so people work around it. Or maybe this isn't good for the fire marshal. Here's how many people have had a table that rocks, or needs some furniture here. This piece of software needs scaling. Pretty obvious there's a problem here. This is a lovely one I saw just recently. Like, people want to recycle, but there's no recycling, so they try their best. And here's a clever design for keeping your motor using cardboard box. Somebody called this input-output. Clever inventions going on all around you. This is a very important thing as a design professional, as a designer, as a creator and innovator. You want to notice what people are doing that's just because they have to do it. They don't even think about it. And then build on that. Now here's a surgical towel made into a holster, very clever. Here's Toes' cable management system I've seen. There's a very common practice I've noticed because I've seen it 4 or 5 times. And here's a guy who built a lovely set of collection of medications for his mother. And then he had a whole backup section so that if he ran out, he wasn't in trouble. Here's a whole bunch of stents in a cath lab, and the expiration date was made very obvious by an extra sticker. Or here's somebody using a big cutting tool to cut right above a patient for orthopedic surgery on the back. Very dangerous, and the guy broke his bone later on in the process. Here's somebody using their flashlight to read his blood glucometer. Not very well designed. This is an elderly lady that said she had no problem opening up her medication bottles, and showed us how. Went into the kitchen and took the top right off, and everybody's going, we're not saying this. But we were watching for signs. If things are labeled, there's an opportunity. Like, people don't get the symbol. A word is worth 1,000 icons, one of my friends told me. press here. What's that? Dispensed isn't good enough. Or if it is new, you need this for old bathrooms now because they don't flush themselves. Or please do not lock your bike to this. Where are you going to lock it? Or not decaf and regular. What does that mean? These are, hey, some designers thought they were cute, but they were not, because you have to put in an owner's manual in hotels to operate the shower. And I challenge you to find one of these cash machines or ticket machines that doesn't have a bunch of extra little stickers on it and little signs, because people can't figure them out. And then these are crazy sometimes. You have to tell people what not to do because they will do it, or else then I just love some. They're just good. So some people can't help themselves but labeling. And so just take your camera. This is one of my favorites. Somebody sent this to me. And someone just sent it the other day, and they said, look, people aren't concerned about Zika. Hey, wait a minute. This was taken off of TV. Yeah, I love these little things, and some of them, you just get in the habit of collecting these. And then my final. So in a parking lot, the picture tells 1,000. So watching for behaviors, here's the tea drinking club, or the bandana wearing and club, or there's a woman who was trying to make the phone system work, and she got flustered, so she just held phones together to have a conference call. Here's people in our office trying to make their monitors work for them, so they're using reams of paper. If 2 doesn't work, 3 or 4 might work. And so, somebody said, well, let's make it look better. Let's wrap them, or let's make the table work with the chairs. We both designed those things. Then the shop said, we need more paper, so here's a nice little stand. And then somebody put paper under the stand. So, yeah, we use our books now to hold our monitors up, and yeah, it's just these are our high-tech devices with our stickers on them now. So be aware of this. Somebody sent this in recently as an animal behavior observation. So, and then just lastly, building prototypes, making things quickly and trying them out. Is a big part of our process. Looking at how to sleep on airplanes, not very easy. And then as a final, taking these kind of prototypes and making them into little storyboards or skits. This is work we did for an emergency room, trying to make the service better. Here's a little prototype we did. Make a full-scale prototype and see what it feels like to be be an app, be an iPhone app. So.
I go and touch again. And he does a different one. And I can go for as long as I want if he has a few signature moves. And when I've had enough and I'm done dancing, I touch the back button. It pauses and the music stops. Once you make.
Cool.
Always have fun too. Making little storyboards. And then lots of little story, but sometimes the story is a valuable part of the final solution.
So, I started this job as a data manager a few years ago, and I was looking into this whole thing about RFID tags, that we need to put on pallets and stuff. And I was working with the pork guys at Excel and trying to figure out, how to amp up sales a little bit, or just find ways in which our customers can do more with pork. And I was talking with a cat for Piggly Wiggly Markets, and I was seeing that the sales of their pork chops in Wisconsin was a lot lower than figures I was seeing from the distribution centers coming out of Minnesota. And I was thinking, hey, what's the difference in these markets? Can you tell the difference between a guy from Minnesota from a guy from Wisconsin unless you look at his driver's license? So I looked at the inventory turn figures that we're getting from the RFID data going out of the plants, and I saw that the product going to Minnesota was the pump pork, and the stuff going to Wisconsin was the unpumped pork. And I thought that maybe I should tell the guy from Piggly Wiggly that we picked up a trend here in the past few days, and it might help him move more pork in Wisconsin. So he says to me, "How do you know?" And I told him, "I don't know why people in Minnesota are suddenly into pumped pork, but I did know that our figures of inventory turn are a lot more accurate than they were before we set up the RFID system. And he's just got to trust me in this one." So he tries it out, and bam, his sales of pork go up in Wisconsin, and he's a happy camper. But the really cool story is what happened this weekend with the heat wave and all. I was doing my usual thing of checking out the flow of sales of pork across the country, and within an hour I get 2 calls from 2 different buddies who are telling me, "Hey, we're firing up the grill this Saturday, and bring the beer." Well, I can only go to one, so I say to Don, who was the first guy to call, I say, "Was he grilling?" And he says he's throwing on some pork chops. I was like, "Yeah, it's the first real spring weekend. I bet there are a lot of people throwing chops on the grill." And then it hit me. I looked at the turn figures over the past few days, and I saw there was a real spike in orders in the West, like in Arizona, while Minnesota and the Midwest were still flat. So I looked at the weather map for the country and saw there was a heat wave slowly moving east. In the warm places like Tucson, where it already hit, sales were going up because people were getting all jazzed about the first barbecue of the season. So I looked at the internal weather forecast program and saw that the heat wave was set to hit Wisconsin by Friday, and this was Tuesday. I looked at the figures of pork going out to Wisconsin and saw that in the past couple of days they were the same as always. So I call our Piggly Wiggly guy again and I say, "Dude, I bet you can move a lot of pork this weekend if you want to." And he was all, "How do you know?" And I told him about the barbecue thing and the weather thing, and he was like, "Okay, you were right the last time, so what do you think?" And I just say, "All I know is that you're going to sell a lot of pork this weekend if you've got it on the shelves." So he hooks up with the customer and they say okay, and they run a feature set for Friday on their Tender Choice product. The Cat Cap guy then calls up Wichita sales and amps up his order of pork by about 20% on Wednesday for the stuff to arrive on Friday. And then the heat wave hits and people are buying pork like crazy and the stuff is flying off the shelves and other stores are running out, but he's got plenty. And the store is happy because their customers are happy because they got all the pork they need for the queue. It was awesome.
So I end with that because that was a culmination of 6 months of work for a big multinational, Cargill, and a big dry kind of PowerPoint and everything. But the thing that really went viral was this 2-day story that took just a couple days to put together that combined all this data in one place. So again, as just a last humanized data, prevention and social determinants, mixed disciplines in your innovation work, use design researchers and become one. Watch for workaround signs and behaviors and prototype early and often and tell stories. Thank you very much, and honor to be here.